I'm Lucy Beednell with the ARC of Northern Virginia, and in this 3-minute webinar, we're going to give some quick ideas about navigating challenging behaviors for people with developmental disabilities. These behaviors can onset at any time, though we do see a lot of them onset in puberty as people with developmental disabilities get older and are struggling more to be successful interacting with their world. If you're seeing a new behavior, one of the first concerns and courses of action should always be able to rule out any medical complications because we all react poorly to pain, and ensuring people with disabilities have all the communication options that they can possibly use to share what they're thinking and feeling, because without the ability to communicate, we all struggle with frustration and anger. Please note that the earlier you get help, the better, because the longer we use a behavior to manage pain, a frustration, or challenges, the easier it is for habits to form that are difficult to change later. There are a number of therapeutic options for people working with challenging behaviors. Positive behavior supports are one, applied behavior analysis is another, often called ABA therapy. Traditional therapy and counseling may help if the person's dealing with not feeling heard or being in control of their life. Therapies like this are often covered by Medicaid or private insurances. Other therapeutic options may be relevant based upon the needs causing the person with a disability to be upset, in pain, or frustrated, like occupational, physical, or speech therapy. And speech therapists and occupational therapists in particular can be wonderful at helping people with developmental disabilities find successful ways to communicate with maximum independence. And physical therapists can be great at helping people gain strength and work through pain. Other options in Virginia include Children's Services Act funding, which is supplemental funding for school-aged kids who may need help additionally in or outside of school. REACH, or CR2, is our crisis support system for people with developmental disabilities of all ages. Their Northern Virginia hotline number is 855 897 8278. Community services boards are the local government agencies that handle developmental disability services and funding, and they may be an option. If you live throughout Virginia, setting up a free voluntary profile with Rapid SOS is a great idea, since it can tell any first responders responding to your home or about you what your needs are, where you live, and special things they should know in responding. For example, things that make behaviors escalate or de escalate. And if you do ever feel like you need to call 911, be sure to make sure you reference your Rapid SOS profile and ask for a crisis intervention trained officer and describe any other calming techniques or needs you have that can help manage the situation. Please feel free to contact the ARC of Northern Virginia on this topic or any others at thearcofnova.org, where you can find our resource library, toolkits, and ask us questions at any time.